renewals on the horizon for many businesses, there's no better time to take charge of your Microsoft 365 costs. We're thrilled to offer our listeners an exclusive 5% discount on your current spending, but don't wait. This offer won't last long. We're so confident with the savings you can achieve with Tenant Detective, our Microsoft 365 licensed savings app, that we're putting our money where our mouth is. Tenant Detective can help you uncover additional savings. Think 20 to 30% by identifying unused licenses and optimizing your subscriptions based on actual usage. This isn't just a discount. It's our way of demonstrating how much better we are as a cloud solution provider compared to your current partner. Don't let this opportunity slip away. Visit plow.net/Microsoft 365 promo to unlock your 5% discount on Microsoft 365 licensing. Offer available for new Plow Networks customers only.
Hey, Cut the Shit listeners. You can find every episode on Apple Podcasts, Spotify, or YouTube. Go check us out. Welcome back, everybody. You're listening to Cut the Shit, a podcast series that aims to take a closer look at the impact of the IT industry, both the good and the bad. Cut the Shit is brought to you by Plow Networks, a managed IT services company based just outside Nashville, Tennessee. I'm Bryan Link, COO here at Plow, and I'll be your host for this series. I'll ask questions, and with the help of our guests, try to dig deep on some of the key challenges we all face dealing with IT. So with that, let's cut the shit and get started. On today's episode, it's my pleasure to have Roni Jamesmeyer from Five9 as our guest today. Roni is a senior marketing manager for the healthcare vertical for Five9, a publicly traded cloud contact center platform provider that's been in the business for over 20 years, where it got its start by providing dialer software for call centers way back in the day. Roni's journey in IT and telco in many ways parallels that of Five9, having gotten her start in traditional cabling and working her way into hosted voice as the industry morphed. In our conversation today, Roni talks about what they're doing to leverage AI within their contact center platform for healthcare companies, specifically their support for interactive virtual agents, or IVAs. Roni lays out what IVAs are, how they are being used, and the impact they are seeing so far on healthcare companies struggling to meet the consumer-oriented demands of their patients. I hope you enjoy my conversation with Roni Jamesmeyer. Roni, welcome to Cut the Shit. How you doing today?
Hey, I'm doing great. Thanks for inviting me.
Absolutely. We're glad to have you. We've had, just so for your context, we've had a voice expert from our side of the table do an episode on Cut the Shit, but that's been a while ago. And his name is Waleed. He's got a deep background in the space, and so did a good job sort of presenting it from that perspective. But looking forward to having you on today to provide, really being knee deep in it on the provider side to kind of help, There's a lot of talk, obviously, about AI and what's going on with automation around all kinds of areas. So it'll be interesting to hear what that means inside the hosted voice space. So before we jump into all that good stuff, I always like to, kind of get my guests warmed up a little bit. So how about you tell us what's the most interesting use of technology or a hack that you've seen or heard about that you've maybe lately that you think you'd like to tell us about?
I don't know if it's necessarily an interest. It's not a good use of technology or a hack, but I was at a conference, not too long ago. And I'll preface this with my middle son is in computer science in college. And anyway, at this conference, they took us on a tour. It was about security. And they took us on a tour of the dark web. And I was blown away by the stuff you can buy on the dark web. I mean,
how dark it is.
Talking about on the healthcare side, we were talking about prescription pads and drugs, and then we were talking about, guns and other stuff, and it was talking about the onion. Anyway, I came home and I was like, I asked my son, I was like, because they were saying if you go home and if they know what this is, then you unplug all your routers and you just reset because that means they're on it. And I went home and I asked my son, I said, do you know about this? And he goes, oh, Mom, that's bad stuff. He's like, don't do that, So he was like, don't go there. And, so it was probably something I had never dealt with, right? But It is alive and well, the underworld of the dark web. And
Yes.
Then I think there's even more layers underneath that. So that was probably the most interesting thing. I've been in tech all my life, but I was not around that. So
eye-opening maybe is a way of describing
very,
that. Yeah.
very.
Yeah. I mean, it's interesting because, that kind of stuff's been going on in the shadows forever. But for it all to be in sort of one centralized place like that that's
like
kind of scary.
It's literally like a store. And they were even saying, hey, even the bad guys want 5-star ratings. So,
they buy into because they're focused on customer service, right? Yeah.
Oh my goodness. So yeah, it was quite surprising.
Gotcha. Good deal. Well, thanks for sharing that. Let's get to the main event. So to get us started, how about give us a quick thumbnail sketch on your background and sort of how you got started in technology?
Yeah, so I got started. I'm not a young person, so I have been around since before the internet. And I actually got started in my IT career in voice and data cabling. So this is when the internet was coming onto the scene, and you were cabling for voice and data, jacks. And we did a lot in the universities, right? The dorm rooms, cabling, this before all the wireless. So I got started in voice and data cabling, then moved up, if you're familiar with the OSI model, the OSI stack. Mm-hmm. Said layer 1 physical cabling, not where I want to live. I moved up into layers 2, 3, and 4. I sold Cisco IT for a number of years. Did a lot of work in the federal space. So I was supporting the military, Indian Health, Army, Marines in selling IT equipment. And then when managed to be in the right place at the right time when the Iraq war started, because I'm in Texas, and did a lot of business there. And then when the war ended in about 2008 and budgets dried up, I moved into healthcare because the budgets never dry up in healthcare. So I worked in the VA, military health, Indian health, and a lot of those areas there, and then moved into interactive patient care, walked a lot of hospital floors. I talked to a lot of from biomed to nursing to patient experience and stuff. So my role at Five9 is the healthcare marketing manager to support all our healthcare endeavors, whether they're current accounts or whether prospect accounts. As we, we already have a healthy business there, but basically to get, to understand the industry more than just from an IT perspective.
Right. And I assume you feel like there's lots of growth there.
Absolutely.
Yeah.
It's always changing like anything else.
Sure. Well, you've obviously got the fleece on, and you mentioned Five9. So we know who you are and who you work for. Give us the rundown on Five9. Tell us who you guys are, what you do, and sort of why you're different.
Yeah. So Five9 is a publicly traded company. You can go and see us on the NASDAQ, but we started in 2000 as an outbound dialer, believe it or not. And that is still one of our best products ever. And we built basically a cloud contact center platform around that starting in 2000. So up until the pandemic started, we were building this cloud contact, CCaaS, cloud contact center as a service. And the challenge was it secure? Oh my gosh, it's the internet. Is it safe? Is it secure? Then the pandemic hit. Everybody got sent home and they're like, yeah, I'll take 2. I'll take 3. Just how fast can you get it set up?
Right. We got to answer the phone.
Yeah, I got to answer the phone. Everybody got sent home. You just needed a laptop, a headset, and some internet, and you were still able to do your business. And then all of a sudden it took off. So we were, that's pretty much where we've been, and verticalized too, as far as from a healthcare perspective. But in general, it's been growth from that point on. So that's what we've been doing. We've never been on premise at all. Always been on the cloud.
So been pretty much a 4-year sprint post pandemic, in terms of the healthcare
before
space.
It was cool. Right? Yeah. I always call it. We were in the cloud before cloud was cool.
Right. You were a dialer, like that. People who've been around phone systems, you kind of, that's not something everybody knows what that is.
We are a telco at heart, right?
So all right. I was going to say that's where those are your roots, right? I mean, in many ways. Yeah. Well, you kind of gave us the background on sort of where things are. Have you seen, just in terms of volume and sort of the, I'll call it deal flow or prospect flow or opportunity flow, whatever you want to call it. In the last 12 months, have you guys seen a flattening out, or has it continued to sort of, obviously nothing was going to keep up probably with that pace in 2021, but have you continued to feel like the organic opportunities continue to grow? And I'm asking that because I'm wondering, does that mean that healthcare still more legacy oriented in terms of its contact center systems than maybe other sectors? I just don't know.
Yes. So I think there's 2 parts to that question. In general, there's still the big move to getting people into the cloud. There's still most systems are on premise, and I think they said it probably wasn't going to get into mass adoption until 2025 from a movement to the legacy on premise systems in general in any industry to the cloud. Healthcare are laggards. I'd say next to the government, they're probably the second slowest to adopt new technology, but it isn't because they don't want to. I think it's just because it's complex. You've got patient records, you got a lot of different systems to deal with, you got a lot more regulation. So it's a slower go.
Some might say they're quasi-government, given the nature of the reimbursement and the regulatory schemes, right?
Correct. And we segment healthcare into pharma, life sciences, the provider, the payer space, and then the ecosystem, the med tech. So they all have different unique use cases. So is it growing? Yes. Is it growing slow? And yes. And then you've got the AI component that's also bringing in a lot of the, I won't say challenges. They're just, they can be challenges or new opportunities, but also with challenges, right? Nothing's a given.
So you got this sort of telco roots, right? You've been cloud forever, or at least, not an on-prem solution forever with the dialer. When it comes to voice solutions more generally, and let's talk specifically about sort of Five9's answer to these questions. What kind of key problems are healthcare companies trying to solve with their? Why are they wanting to do this? Let's sort of start there, and then talk a little bit about why Five9. Because no disrespect, but you're not the only show in town, right? There are other people that provide the same. They provide comparable systems. So, what are the problems that healthcare companies are struggling to solve, or what jobs are they trying to do with their voice? And then what's Five9's answer to that?
So, very good question. Some of the common problems in healthcare today, as they've come out of the pandemic, they're trying to get their sea legs and their financial stability. So that's there. Workforce shortages are huge. That's going to continue. Nurses are retiring at clips. Doctors, providers, they're burnout. That's not going away, and that goes down to the contact center agents, down to the cleaning people, right? They're just burned out. But also, healthcare now has to be more retail-like. They have to fight for their business. When we were growing up, you just went to the doctor. The doctor was there, and you worked around the doctor's hours. If they were open 8 to 5, you went when you could. Now, if you don't get the doctor you want, you're shopping. You're shopping around, and there's Yelp for these guys, Yelp reviews, and that. So financial institutions are trying to do a couple things. They're trying to attract the consumer to become a patient. So the salesy organization, the retail organization attraction, and then they're also trying to attract providers because they don't want them leaving, because every provider who leaves is a loss of dollars. So to combat that, or to address that, part of it is self-service. Part of it is, what we call omni-channel, a lot of outreach on the preferred channel, just being more convenient to use, convenience in appointment scheduling, convenience in prescription refills, convenience in finding the right resource at the right time and being available. Now, it's a multi-pronged process. There's a lot of point products that are out there doing that today. You swing a dead cat, you can find a new one. There's a new business starting up tomorrow. But it's all about the data and getting the data to collecting it in real time and making use of it. So I think some of the attractions that Five9 has is we're very, very data driven, have a lot of data reports, a lot of areas that we can collect data, because we're collecting it from the time the phone rings all the way to the interaction. But also, the omni-channel outreach too. And I just lost my train of thought. There was one more thing about the data. Oh, voice. I was going there. Thank you for that. I just reminded myself. About 25% of the calls in healthcare are eventually going to convert to voice. And that's unlike Amazon, or, you buy a blue shirt. How many questions are there about buying a blue shirt? Does it fit? It's short, it's shrunk.
Right. The universe of questions is limited, right? It's finite.
Finite in the retail world, but not in healthcare. Your DNA is different than my DNA. And so you can get a large subset of calls contained, what we call self-contained, but there's always that, oh, by the way, I still need to speak to someone. My bill is wrong. I have an allergic reaction. I really want to know about my drug. If my drugs are, interfering with each other, etc. So there's a voice will never really go away in healthcare for that reason, and that's a good thing actually.
Well, yeah, I mean, I don't know about you, but I certainly have a different emotional connection to the healthcare experiences I have as opposed to buying stuff on Amazon, right? I care a lot more about that than I do, and there's fear and trepidation depending on if you're having to see someone because there's a problem and you don't know what's going on, or there's a lot of emotions involved, and that almost, that's going to translate into people saying, I don't care how good your IVR is, or if you've got, I need to talk to somebody, right? There's that sort of human element to it that I think is never going away.
It happens all the time. It even happens with me, right? You have family. I can't tell you how many times if your child is sick, you're going to be very conservative. I just had this with my father. My father about a year ago at Christmas just fell. And he hurt his shoulder. And we're all like, should we take him to the ER? It's Christmas Eve. And we're all around the table going, all right, how bad do you feel, Dad? And you're going to press that panic button in a New York second.
Right.
If it's your child or your parent or, your loved one, right? And that's where we got to, where we can help maybe contain those or get you to the right professional to just say, hey, this, you calm down, we'll get you taken care of, we'll get a prescription, we'll get an appointment, whatever, et cetera. Is it, the E911 call? So. Yeah.
So let's use that. I think that's maybe a good segue into sort of this interactive virtual agent concept that you guys are working on, right? Tell us a little bit about what an IVA is and what Five9 is doing there strategically. What's it supposed to do, and how does it help solve that problem you just described, where you've got, let's say a healthcare system right now is at 50% voice, meaning 50% of the calls are getting connected to a person, right? They've got an IVR, and some people are willing to deal with the phone tree, and other people are like, just give me somebody to talk to, right? So tell me about what role does an IVA play in that kind of an environment? Because my assumption is that's what a lot of current contact center, data looks like. Just my guess.
Correct. So an IVA, or an intelligent virtual agent, they go by a lot of names, but it's basically a virtual bot. It's a digital bot that's voice enabled. So it's how can I help you? Your traditional calls have been, the IVR, interactive voice response, is your traditional press 1 for sales, press 2 for billing, press 3 for clinic, etc. And those aren't working. It kind of hurts my heart because I've been in voice for a long time, and you would think that's pretty simple, but many people fat finger it. I know I can't remember by the time you get to 6. I'm like, well, what was 1 or 2? None of those fit me. What do I do now? It's, and so that's where you get into the complication of the IVR. So the virtual agent is the digital bot that's natural language that says, how can I help you today? I'd like to speak to a clinician. Okay, I heard you say a clinician. Can you give me more information? Or also authenticate. Every single healthcare call is pretty much got some personal health information in it, right? You got to validate that Roni is really Roni before she goes and you address what she's calling about. That's 20 to 30 seconds of every single call that a human agent doesn't need to be tackling. A virtual agent can collect that data, validate Roni, and steer Roni to the right area that she's interested in. And now you've gotten 20, 30, 40 seconds of a call taken care of before you deal with a human agent talking it. That's huge. That's huge. And maybe you can even contain that call because maybe Roni just wanted to know office hours, or, where do I park when I go to my appointment tomorrow, and stuff like that. So there's a lot of that a virtual agent can do. And where we see benefit is the authenticating and the call steering, because that is a huge problem. And what it actually does in some cases is you think it would decrease your call volume because you're containing a certain subset of calls. But in a couple instances, it's increased it because more calls are getting through now that you didn't know you were missing. And
right. So we talked about the metrics, right? And I that sort of wait times and drops, and just not people being able to get through because of, there's a natural capacity limitation there, right? Whereas this, if you're turning them right, you can get more into the pot, so to speak.
Every transfer is taking up a line, right? So that's 2 or 3 lines could be taken up because you're transferring from here to there, and from a telco world,
right?
You want to free up those lines.
Right.
So that's where the virtual agent comes in. It's part of the self-service. It's also part of the 24/7, right? Because those guys can be working at 3 a.m. when your child wakes up with a fever and you're trying to get an appointment at 9 a.m., a first appointment.
So, you're on the 5'9" voice side, right? So this sounds, the pitch here is you can be more efficient. So in essence, your cost per call could go down, but also have higher service quality, that people could actually be happier with the experience. Give us some data, or help us feel better about that. That's not just that's not just a sales pitch. Give us some examples, or at least some anecdotal data to support that sort of 1 + 1 = 2, where it was generally those have been trade-offs, right? Efficiency and service have normally been thought of as trade-offs, not mutually supportive.
Yeah. So we did one of the things I did when I took this rollover was went to every single healthcare customer that we had that was using an IVA and said, went to every one of them and said, what did you buy it for? What pain were you trying to solve? Did it solve for that pain? How do you know it solved for that pain? How did you measure it? And then what lessons were learned? Now in June, we just published an e-guide. It's on our website. This isn't a sales tactic, but basically it was to say, we've got real ROI on healthcare customers of various different verticals to say this is what they got out of them. And not all of it was about saving money or making money. There's a large subset of that, right? I don't want to hire more people. Can I take more volume of calls with the same amount of folks? There were that, but some of them were absolutely just, we have patients that are just pissed off and, they're going to leave. One example I'll give you, and it's in the book, is a durable medical equipment company called Aeroflow, and they have a breast pump. They have multiple different departments, but they did it in their mother baby department because they said, we send the expectant mothers and new moms, all this information of the status of their breast pump, where it is, where they can find the information. It's on the website. We email them, but yet they call. And they're tying up all these lines for more important calls if they would just read it. Now, we can't make them read it, but if we we just want to make them happy, right? They're stressed out. And we just want them to make them happy and get them the information they want. So they put the IVA in to kind of steer them to where this information was. And they had a much happier client base. And that was their only metric. Just make these patients, make these mothers, less stressed.
Right.
And it's, that was their only metric, and it's been successful. And now they're moving it into their urology and their sleep apnea departments, which have a larger subset of patients and stuff. But there's various, Bryan, there's various reasons for using it. And I like that because it's not just, hey, I got to make money. I got to save money.
Right.
But there's plenty of that to show.
I read the white paper. We'll put a link in the show notes so that people can go if they want to request it, because you can go to the website and you got to give them a little information. You know how that works. So
it's just a gated document.
You get some marketing information, but it's good stuff. It's a well written report, and it was helpful to me in prepping for this call because I'm in the space, so to speak, but not really. I mean, I'm no voice expert, right? So to hear sort of into the nitty gritty of how an IVA, what's happening on the ground, so to speak, was good for me. So
it also tells you a little bit about how to build one. If you're interested in kicking tires or doing it yourself, we're going to give you a straw man. So it's not like you have to buy 5'9".
Right.
There's a lot of technology that can also do it for you if you want to.
Yeah, there's some real structure in there if you want to do this, like it sort of gives you a playbook. So
yeah.
Kind of along those lines, I think, was in the sense of you sort of reference different, you can achieve different goals, right? This technology, this approach can help you solve different goals depending on what your business and what you're providing, whether you're a provider or a payer or whatever, right? Your goals could be different, and it's a little bit of a Swiss Army knife from that perspective. What misconception do you feel like you and your colleagues in marketing are working hard to dispel when it comes to hosted voice and sort of contact center technology? I mean, are there misconceptions out there? I mean, I'm asking that, making the assumption there are, but perhaps they're not. But if there are, what are they, and what are you guys working on to try to deal with that?
Well, I think a lot of people think, especially now with Chat GPT and AI, that it's not secure. So they're very worried about their personal information. And for the most part, what the virtual agent does is just never keeps it. It's only transferring the data to the system of record. So, in 5.9 world, we are just pushing, we're authenticating you, and we're doing those types of steps to make sure it's secure. And that is easy to do. So you're hearing about deep fakes and stuff like that. And we can approach those different ways, right? By, the unique questions. What's the name of your cat? And stuff like that, those secret questions. So there's a lot of ways around it, but it is very secure, and we don't keep the data. So it's always going to the source of record. So whoever the customer is. A lot of people think it's hard. I would say that you got to set the expectations of where they want to go with it. It is not a set it and forget it type technology. It is always requiring tuning. It's always learning. And when I say learning, it's utterances, right? How many ways you're going to say, I need to see I'm hurting, or I'm in pain, or I don't feel good, right? All of those things. And then talk about different languages. But you want to, tuning is, you'll get more value out of it because it'll do more work for you if you tune it and get it into it where it's identifying what you're asking and getting you to the right areas. So those are some of the misconceptions. It is very secure. We can address those, but a lot of times when you're getting into the PII or your personal health, we're out of the picture by then, right? We're not clinicians. We are basically just trying to get you to the right area as fast as you can, as safely as you can. But we want you to be happy with it and not have many repeat calls and stuff like that. So does that answer your question?
It does. One question I have, or that if I were a potential buyer in a decent sized healthcare system, I'd probably want to know what's my integration effort look like to make this baby work with my systems, and what's that piece of the puzzle look like for getting a system up and running?
Yeah, and that's a good question, because in a health system, it depends on how many systems they have. And, a health system may be using their EHR for appointments. If it's an Epic or Oracle or NextGen or eClinical, then they'll have maybe in their outpatient area, they may have a different system. And so the biggest challenge I would say is, how do you consolidate? Do they have a consolidated area to take calls, for all appointment calls to go here and then go out? Or do you have them come into different areas? Those are the challenges, but there's a lot of different systems. So those are the things we want to mine down and figure out and see how much of the tech stack we can reduce, because that is some of the areas of value to you, is if we can take some of those point products out and allow you to do more without it. That saves money, but it's also where your data is going to store, right? So it's I'm not sure I answered your question. There's no one real way to dictate. It's all about how many systems they have now, and they have a lot.
The answer to that question is it depends, right? I mean,
it depends. Yeah.
And my assumption is you've got a bunch of pre-built integrations to the. Yeah. I mean, if someone's got an Epic EHR, it's not like you've never run across that before, right? That's correct. Pretty clean, or at least I wouldn't say clean. There's no such thing in healthcare, but it's not a custom homemade EHR system that somebody built 20 years ago that they're hold together with baling and wire that they want you to, provide a nifty integration into. That's a whole different ball of wax.
Correct. You got it.
Good deal. All right. So final question. When you think about the current situation, you think about 5.9 and the business itself, and sort of, and maybe even more broadly, sort of the current state of voice, sort of, we'll just say hosted voice, because it's pretty much all going there. Like, it's not, the old phone lines are, I guess they'll hang around, but it's not really what we're doing anymore. So when we think about that ecosystem, do you feel optimistic or pessimistic about the future going forward, and why?
I do feel optimistic, because I think, as I mentioned earlier, voice calls aren't going to completely go away. Will they drop and some be preferring digital channels and other metrics? Yes. But like I said, a lot of calls, or percentage of calls, will still go to voice. So that's not going to change. There's also, we're trying to connect to the internal clinical communications of the health system. So I see Cloud Contact Center as being an orchestration hub with what's pushed outside the health system. So remote telehealth, home care, patient at home systems, hospice, all that, because there is a big push for that. And that could be a lot of digital. But then you've got the health system inside where you're basically, grandma got admitted last night and you're calling in to find out where room grandma's in. And those are what we call answer transfers. And we're starting to see more connectivity where we're going to connect to those clinical systems where and voice is a part of that. It could be, paging, it could be the cell phone, who's on call, who's on duty, and connecting to those systems. So the whole idea is to have a unified journey, which it's not today. And it'll be a while before it gets there. But what Five9 is trying to do is connect those parts in where we fit. Voice is a component. It won't go away. It's not probably the main component, but it will still be there.
Right. And maybe even redefine, it feels to me like we're sort of redefining voice, right? Because you're using that term specifically to mean human to human, right? But I can make an argument, at least intellectually, that talking to an IVA is a voice call. It's not with another human being, right? I mean, and there's potential future where the percentage of the capability that IVA continues to improve, and therefore the percentage of actual human-to-human conversations continues to go down. The skill sets of those people who are ultimately taking those human-to-human calls has to continue to go up, because the only reason they're getting there is because it's something pretty strange, right? Or it's pretty unique.
It's a skill. Yeah, the skilled part, the skill-based part. So you're not wrong. And that healthcare at the end of the day is a human. It's human-centric, right? I guess there may be one day, not my lifetime, where a robot will be taking care of us and it won't be a human, but I don't see that anytime soon.
Yeah.
So
I don't think we're there yet. That's for sure.
Yeah.
That's for sure. All right. Well, listen, I always like to wrap up with something personal. It's not too personal, but it is personal. I know you're a busy person. Sounds like you got a lot going on, but tell us about something you've watched or read lately that you think others ought to check out.
So not related to healthcare at all. We've
totally
been,
fine. In fact, maybe even preferred. So
no, yeah. So I have never watched The West Wing. So this new West Wing book came out called What's Next, which is the behind the scenes of West Wing. And so I was reading that and we're like, no, I got to watch West Wing. And that show was probably 1999 or 2000 to 2006.
Yep.
And it's still the same conversations we're having today I'm just sitting there going, this is 20, 25 years ago. They're talking about the same problems, education vouchers and stuff. And you're like, oh my God, and nothing's moved. And so that was kind of a big, interesting fact is how little has moved on, and I know it's fiction. I mean, I know it's a TV series and fiction, but it's pretty ironic.
Yeah, well, it's pretty realistic from that sense in terms of the issues and the topical kinds of. I mean, the Jed Bartlett administration was dealing with the same things that were topical then. And to your point, I mean, immigration was a problem in 2000, and it's a problem today, right? We haven't really moved much on that. To your point, school choice. That's not a new issue, right?
Nominating Supreme Court justices, I was just like, holy
correct.
Cow.
These are sort of,
all playing out.
I'll call them permanent. I mean, because they're not, if they were easy to solve, we would have already fixed them, right? I mean, that's
agreed.
That's for sure. So, All right, last question. Tell us about your first technology memory as a child. Maybe it was a gaming system. Maybe it was an early stage computer. Who knows? An erector set. It could be, who knows? What was it for you?
I remember I just remember a lot as a teenager, the telephone being in the kitchen with the long 15-foot telephone cord and everybody running to the kitchen when the phone rang and grabbing it. And my father used to work for the phone company back in the day, and I was cleaning out his garage not too long ago, and there was a rotary phone on there, and my son was like, "What's that?" And I was like, so this was, precursor to the iPhone, and he's like, "What?" And I'm like, yes. And it used to be connected to a wall, and we used to have a big long cord, and we'd, walk, you couldn't go. And long distance was a thing. It was always like, don't talk to grandma, cut her off. You've been on the phone too long.
That's right.
Oh my God, that's expensive. So that's what I remember.
We had a similar situation with our phone in the kitchen. And I remember in terms of technology, I don't know where my mom or dad found it, but they made these little things where you could plug them into the bottom of the handset and the cord would attach into it and it would spin so it wouldn't get so tangled up. And I remember thinking that was like the coolest thing. Like that's that's where we were in 1986 or whatever.
That's exactly
85.
right, man.
Yeah, it was a while ago.
Yeah.
That was a while ago.
Not too long ago.
Yeah, that's amazing how fast that's changed, though. To your point, there's, our children, my children don't really remember a home phone. I mean, if they do, it was a cordless. So it was kind of like a cell phone to them. I don't think they really knew the difference. And they certainly don't remember the world without cell phones.
I know. Exactly. And I'm going to be like, when you have kids, you're going to say, I used to have this iPhone, and your kids will go, what's that?
Yeah, they'll laugh about that too.
I can't wait for that day.
Yeah, that's right. That's right. All right, well, we'll wrap up there, Roni, and let you get back to it. Thanks again for taking time to be on the Cut the Shit. We really appreciate it.
Yeah, this is great. I'm looking forward to, I listen to your podcast every once in a while, and I'm happy to be on it. So thank you very much.
Very good deal. And 5'9" is there. You guys are one of our partners, so we're excited to be in partnership with you, and we look forward to helping folks along the way who've got voice needs to make sure they get in front of you guys as well. Appreciate that. Good deal. We hope you enjoyed this episode. If you are enjoying the podcast, we'd appreciate it if you would become a subscriber wherever you get your podcasts. And if you could rate and review the show on Apple Podcasts and Spotify, that would really help us out. Or you can just go old school and tell your friends, your family, your colleagues, and hell, anybody else who you think might want to hear something like this to listen in. If you're on social media, make sure to follow us on TikTok @CutTheShitPod, all one word, where we post lots of clips from the podcast. And last but not least, you can also watch the YouTube version of the show on our YouTube channel @Plow Networks. Until next time, take care and have a great day.